Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Us in public health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods, they cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, is really important.
CERCL is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of CERCL is to address the health inequities that our communities of color are facing on a daily basis.
Good evening. Thank you for joining us to our conversations in the community. Today, we're going to be talking about myths and facts at COVID-19 vaccine. Next, please. I will be your host. I'm Nayeli Mora. I'm a research assistant professor at Loyola. I'm part of CERCL as well in infectious disease epidemiology. With us will be Evelyn Vanderbilt. She's with a colleague in CERCL. Tomas Morales, which is an internal medicine resident, and we have Ms. Gwen Smith, which is our community liaison. Next, please. Before we move on, I would like to acknowledge Loyola Medicine's COVID-19 Vaccine Community Advisory Council, their support along with support of the Village Press. We are different community stakeholders that we do care about our communities. Next, please. So for tonight, we have something special for you. We're gonna do like every week our update in our dashboard, meaning the cases and the vaccination efforts where they're going through. Then we're gonna talk about some facts and myths about COVID vaccine, specifically among women and all of us too. And time for questions and answers, which is the most important part of these conversations. Next, please. So then let's focus ourselves here in where are we in the pandemic in relationship just to suburban Cook County, right? We hear a lot in the news about Chicago City, but let's focus a little bit narrow scope to our community and Cook County and specifically to the west suburbs. We have the most recent data. We know that this west suburban county has experienced the most number of COVID cases per capita than other regions in suburban County, and this hasn't changed for many, many months. The rate of total cases is very similar to that one from the city of Chicago, but guess what? We don't have the same resources. We don't even have the same amount of resources. Here, there is a map, and we call it heat map, and we can take a closer look. The areas of which are highlighted or darker blues are those with the highest cases of COVID rate. And now these are concentrated in the Proviso Township area, as well as Cicero and Berwyn. Next, please. Again, another map, and this is what we show suburban Cook County communities that have been disproportionately impacted by COVID-19 and are vulnerable to barriers to COVID-19 vaccine uptake. This vulnerability is based on a combination of factors related to sociodemographic epidemiology, the occupation of people, and the cumulative COVID burden. Again, these areas highlighted in darker blue in the map that are those with the highest levels of vulnerability. Therefore, it's not surprising that municipalities in western suburban County are faring poorly. Here's a snapshot of 14 of the selected those municipalities located in this Cook County. So you can see 9 of those 14 have considerably higher test positivity rates and case rates. The figure to the right will show the 3 worst faring have more cases, 2 more higher than ones in the suburban Cook County as a whole. Next, please. So, let's see. So just here to show you up and just to remind you, right, all the tools that we have in our hands of protection against the COVID-19. And we are responsible of wearing a mask, right, washing our hands, avoiding crowds, the things that are individually responsible. Now we have the resource of a vaccine, and that's a responsibility to get another layer to avoid the disease, to avoid the burden to our community, and help us all. Next, please. So now to show up how are we doing with our vaccinations in the suburban Cook County. This is data according to Cook County Public Health Department. And we can see here all those cases, and more like 1 in 3 residents have received at least 2 doses of the vaccine. And we can see the percent of people that have 41% have completed 2 vaccinations. You can see where are we in the West Suburban County. And remember that right now, the people 12 years and older are eligible for vaccination. Go ahead, please. Next, thank you. So if you're still wondering how we can sign up for a vaccine, there are actually in many places that we don't even have to sign up. There are a lot of walk-ins, and we just can go to the places. But where are these places? You can find them in this website in the Cook County Public Health Department. Another way to find them is calling by phone and see which one is near to you and your convenience. See the dates that are open and also the available schedules. If you need further assistance to do so, we can help you. CERCL is we are an organization that was formed specifically to help people efforts to vaccinate and to test against COVID. You have the website there, and you have our phone information list there. So now let's get into our topic. So there's been an onslaught of information about COVID-19 vaccines shared in the news, social media, with our neighbors everywhere. And it has contributed to a cluster of myths about the vaccine that have fed skepticism about the purpose and safety of the vaccine. And therefore, many people is scared about vaccinating. But I want you to point out here in this graph that I found a couple of days ago, and you can see in green, in the green slope, how the cases of vaccination, how many people is getting vaccinated in relationship to the other line that you can see going down, which are the cases of COVID-19. So this shows you up that the more people we get vaccinated, less cases we have of COVID-19. Next, please. So what is on our first list is a myth. It's saying there, the vaccine will give me COVID-19. And the short answer is no. It's not with existing vaccines. And here we have a graph that I pull out. There's like many types of vaccines. And yes, we do have live attenuated vaccines, We have the one live virus vaccines, but we don't use those in this case. And we do like synthetic vaccines. I mean, the ones that we have currently in the United States, which are the Pfizer, Moderna, and Johnson & Johnson, mostly use the mRNA vaccines. And it is just to help us to fight to the vaccine, but it doesn't give us, it's not the virus, so therefore I cannot get ill, right? So they're just gonna give us the immunity. Again, next one, please. Some examples about these vaccines classified by the type of vaccine, as you can see. Amongst those that we have the RNA vaccines, we have the COVID-19, but this is not a new technology. It's something that has been developed for a decade or more, and it has been applied to cancer treatments, very specifically, and a wide range of variety of cancers, going from breast to lung, small cells and cancer, and also to mycobacteria, which is the organism that causes tuberculosis. We have here other types of vaccine recombinant, and some we know that there's no vaccine right now for HIV, but they're trying to do so, hepatitis B, hepatitis E, and so forth. So, but right now we're in the other spectrum of the vaccines, which are more synthetic vaccines versus the live attenuated vaccines that you can see on the other side, and therefore you cannot get the disease from getting vaccinated. Next, please. Another thing that's been made is that we say that, can we trust COVID-19 vaccines because they are being rushed? So first, it may be important to explain that patients that while there was first vaccines for COVID-19 do not involve this new technology. As I said, they were developed in a record time, yes. There were no shortcuts in the process, however. This messenger RNA vaccine technology, again, we have tried in many other areas. And just to show you a snapshot of how many trials or how many studies were when we were trying to develop a vaccine for COVID-19 were there. We have all type of vaccines, and you can see the percents there. Some of them are the RNA messenger vaccines. But by any means is that the only trials were those. There were no rush. There was a lot of people working at the same time with the same objective, and therefore, instead of taking 10 years to get to the same outcome, we get it in less than a year. Next, please. And another thing that we've been talking about, we have heard a lot, these vaccines will alter my DNA. And the truth is that they do not. Again, they use mRNA vaccine to instruct cells. It's like an instruction manual to tell the cells how about the piece of the virus, to tell you how to build an antibody against this protein. And this protein, we call it the spike protein, right? That we know is found in SARS-CoV-2 virus, right? And once this virus is broken and we get the vaccine inside, our DNA, yes, learns how to replicate this vaccine, and therefore is going to interact and react to this virus and learn how to do these antibodies. But they do not alter your DNA in any way. Next, please. And also the thing is that we don't know what is in these vaccines. Actually, we do know. As we said, is both Moderna and Pfizer vaccine have published the ingredients, and actually that for them to be available for the public in many ways, even if it's an emergency approval, they do have to disclose all the ingredients. I just pulled out here, I don't want you to read them, but each one of those were pulled out from the FDA approved form that ingredients that each of these vaccines do have. One thing that they would have in common, they have either some salts or some type of sugars, right? That they will accompany the vaccine either to get them through the body, right? And they will have a vial or a way to get into the body. It has to get attached to something that it has been developed, and we actually use it in many other products and cosmetics and other food items and other pharmacy and other pharmaceutical products. And that will be like this strange product that goes in those vaccines. And it says that might develop some allergy type of thing, but not necessarily the RNA vaccine. But we do know the ingredients. There's nothing hidden from us. There are no, and another, sorry, I just want to say something else. There's some theory circulating about in social media that they contain microchips or tracking-informed device. No, if they want to do that, they do it already with our cell phones, right? They don't need to get us a vaccine like that and get many millions of dollars involved in that. No, this is just to protect us. Following, please. Another thing that we have here is like, or me, this, I already have COVID-19, I got the disease, so I won't benefit from the vaccine. I will say that's not true. Again, even if we don't know yet how long natural immunity from COVID-19 lasts, either the disease or the vaccine, as right now it seems that getting COVID-19 more than once is not common, but it's possible. And we don't know when we get the disease, how we're gonna react the first, the second, or third time. We can end up in the intensive care unit or even worse. Getting COVID-19, yes, it is true, it can get some natural protection or immunity from infection of the virus, right? But remember, there's some variants running around there that might not confer the same immunity, immunity or protection against some. And again, the complications is a big thing. And why will I don't do a vaccine when I can get avoiding these complications? They also said, it has been said that if you have had the disease and you get vaccinated, you can actually boost your immune system to get fully and range protected. So no, that we do need to get a vaccine even if you have had the disease. I think that is, importantly, is that we want to protect our community members, right? And particularly people that is at risk of the severe illness of the COVID-19. So getting vaccinated not just protect us, it protects the people around us. Next, please. Another thing is like, since COVID-19 survival, the disease is so high, we don't need a vaccine. So are more people able to recover? Yes, we know some people will develop severe complications, and that's the full problem about this, right? A lot of people that get this disease end up in a hospital and get like a severe illness, like an intensive care unit, and maybe they don't recover. So far, that 1.6 about 3 million people have been around the world that have died from this disease, and that's why it's a pandemic. So we have not should discard that is the importance of the disease itself and the severity of it. You can see this in this graph, like the cases are not still of death, are still high, right? It's not like it's going anywhere. People that get affected severely might get very ill. Widespread vaccination, however, will protect the population, and that will include, again, the most people that is not at risk and people that cannot be vaccinated for other reasons. So for ending the pandemic, it's important for us to get vaccinated. And I think in these models that they were running, it is a mathematical model. It's just how the people estimates what's going to happen during the pandemic. If we stay in the current rates of vaccination, we're not going to end with this problem. We need to reach out higher levels of vaccination to get over this this problem. We will say so. Next, please. Next, please. Okay, there you go. Thank you. And this is again, the forecast for the state level, and this is from Illinois. And you can see that that's for the next 4 weeks will stay in the current state of vaccination. So even if about 40% of the population in Illinois has been vaccinated, that does not help us to get herd immunity or collective immunity. So it is still important for us to not get the disease, so we don't get the outcome of death or severely illness. And remember also that some people, even though they do not get death outcome and they recover, some of them will have long-lasting effects. Follow me, please. Another thing that people have been talking about is, once do I get the vaccine, I will not have to wear a mask or worry about social distancing. Well, we have known that like the guidances have changed in the last weeks. That's true. But let's first a little step back. What we're going to define as full vaccinated. We define as fully vaccinated somebody after 2 weeks after the second dose of the Pfizer or Moderna vaccine, or 2 weeks after the single dose vaccine of Johnson & Johnson. Following. But still, the social measures of masking, physical distancing, and hand washing remain important. Among those we have not the vaccine, and depending who we interact with and where is the setting. Here are some guidance from the CDC, and it's like very simple. Even if we were tested, to prevent a severe illness, we still need to do some guidance. So we're gonna have this resource available in our website, but I want to say, like, we still do require or recommend masking when we go to settings like a grocery store or crowded places, right? Even if it's outdoors. I know the CDC do recommend that we do not wear face masks, or we cannot, face masks are allowed in outdoor settings, but depending where you are, right? There are areas that people is not vaccinated for whatever reason. So why should you remove your face mask? You might live in a home, right? That you are vaccinated as a grown-up, but you have young children, you still can be a carrier of the virus. So depending where you're going, if you're in a public transportation, you should be wearing a face mask. So there's like a lot of changing issues in this. Yes, it's confusing sometimes, even for us, we try to transmit the information, but staying current about this information is important. So you always can refer to the trusted sites of the CDC, which give us a guidance. Appropriate guidance. Next, please. And as you can follow here, there's who are including here the not vaccinated with the people that is vaccinated. So we have families, let's say grandparents got the vaccine, but they go with children that they're not vaccinated, what they should do and not. There is a specific guidance about that, and we should follow or be cautious about not trying to spread the virus until we reach out a certain percent of the population with vaccine. Now, remember that 12-year-olds and older are electable for vaccination right now, so it's gonna get better, hopefully, within time. Next, please. Another thing that we've been talking about is, like, now that we have vaccines, the pandemic will be over soon. Or we would love to say that we're gonna flip and switch everything just right away, right? But I think it's gonna be some time until we be able to vaccinate first everybody, right? And we're talking about an adequate number to do so. And as far as I know, it's about 70 to 75% of the population, including children, which we know is not, like, small children are not eligible yet. And a point that is called herd immunity, which is the collective amount of people that cannot get infected again, then little by little, the disease or the epidemic will wane or die. We know that the vaccine is distributed in people in greater need and then just going downwards. Something else that we need to consider is, like, the people with travel, right? And traveling is so easy, and not all the world and not globally we have the same availability of vaccines as us. So we're gonna be still in this in and out for several months at least. So that's why we need to do our part and keep on our measures and do the most as we can vaccines. Next, please. And I think this one is a very common one. COVID-19 vaccination will cause me to test positive for the disease. Well, while we know that COVID vaccines cannot cause a positive COVID test, right? We know that those tests are to know if actually we have the disease, not if we're vaccinated or not. If we want to know if we get a good immune response, we have to do a different test, not the test for COVID. And therefore, as we talked before, the COVID vaccines cannot cause an infection. Therefore, we don't get the positive for the COVID. So there's no point in doing this. Next, please. A couple of weeks ago, we talked about this, specifically in women around fertility and pregnancy. And one of those myths is very high among young women is that if COVID vaccination will affect fertility. And it's just not when women, also men are involved in this, and there's no evidence that they do so. Actually, there's no problems to getting pregnant, there's no problems to have offspring, and it's safe to get the vaccine if you plan on becoming pregnant. Actually, if you are not pregnant right now and you're thinking about that in the near future, do get vaccinated, because if you're pregnant and get the disease, you can have severe complications, and do pregnant women have higher risk of getting complications of COVID-19 disease. So you actually want to get vaccinated. I just want to have a word here about the pregnancy while you're pregnant. Like with any medication, the first trimester is not recommended to have any type of medication. There's no contraindication, however. But if you're pregnant, you can get the vaccine applied to you. And the good news is that if you get vaccinated, you can transfer the immunity to your baby. We don't know how long it lasts, but normally, if you get vaccines, or you are the children, that when you transfer the immunity to the child and to the newborn, it will last until they actually develop their own immune system, or they get mature the immune system with about 9 months or so. So I think next one, please. I think that's all that I can get now, but we're open to your comments and your questions. And this forum is for you, so please put your questions in the chat and we'll answer the best we can. Thank you.
Thank you so much, Dr. Mora. That was a great presentation. We're also going to welcome Miss Gwen, who is our community liaison. We were just wondering, Miss Gwen, do you have any thoughts after listening to that? And have you been hearing anything out in the community? Any questions or anything that you wanted to bring up tonight? Oh, Miss Gwen, you're on mute.
Thank you, Dr. Moore. Great presentation. Thank you very much. One of the questions I have, if they're coming out, I've heard people say if they're coming out with a booster, why should I take the vaccine?
Well, again, the vaccine was developed for the first virus that we get. We know we are currently some type of mutations in the virus, and the boosters are attempting to protect against those variants. So it is important to get the vaccination, and also we do not know how long it's going to last the immunity, right? When we develop the immunity, is so far the information that we have is between 8 and 12 months. Still to know about that, but I think it goes more in the direction that yes, we might need a booster, just like the flu shot and many other measles for the children, or many other diseases that are preventable by vaccines. You just need to remind the immune system that, hey, this is important. Keep on doing antibodies, and maybe we have a little variant and little new protein. We just gotta add it to the recipe. That I will say that.
Another question. If everyone around me is immune, then why do I need to get the vaccine?
That's a very good question, Ms. Gwen. Immune as vaccinated?
Yes.
Well, again, we don't, it's so recent that we don't know if we're carriers if we're vaccinated, right? Might be less probability or likelihood that we can carry the amount necessary to confer a disease amongst us, but we do know if a person that is susceptible can get the disease because he's not vaccinated. We all have a different immune system. So you happen to have a weak, no symptomatic immune system, and I'm a vaccinated person with a carrier, I can infect you. So yes, you have to vaccinate yourself.
One last question. I heard this from teens that some of the teens are not getting vaccinated because they're afraid of getting sick with that second shot.
Oh, you've been vaccinated, Ms. Gwen?
Yes, I have.
Okay, let me ask you, how do you felt in the second dose?
The second shot, I did get sick a little bit for maybe a day and a half. I had a slight temperature, and I was, weak. I had to really, have some bed rest, but we probably need that.
Well, you, let me
and
just keep,
and
let
I
me just
took
keep
some
on
time
discussing
out. I
that.
was fine.
Well, that's what you define sick.
No,
You want to say? Yeah. Okay.
No.
So we call that like some little side effects, and some people we actually have it with a lot of vaccines, not just particularly this. We're just paying so much attention. But do you rather have 24 hours of a little chills, perhaps fever, yes, pain in your here, right, and not feeling good, or getting super sick with pneumonia and in the intensive care unit?
I think I would take the 24 hours.
Yeah, me too. And actually, I must say, when
And I
lived.
lived. I'm still here. I'm alive.
Yes, we are. I must say that I did have my second dose. I did experience some chills and weakness that you're not bad, but you're not well, right? And I don't want to work that day. But I was very happy thinking that I will be avoiding some other possibility of getting sicker or more intense things. I'm happy that I will be less anxious on bringing the disease to my home. I have a young child. So I was thinking, well, even if we don't know we're carriers, as I said, the likelihood of doing so is less. Now for young kids, right? Like as you said, like teenagers.
Yeah.
Well, let's get the chance to get them together, right? If you're in a pool of vaccinated people, you actually can get unmasked and get back to school, back to summer camps and some activities that we need to socialize so much of these days.
Thank you.
Are there any other myths that either of you, Dr. Mora or Miss Gwen, have you heard that we wanted to bring up tonight?
Not on my end. What about you?
I'm sure there's other things out there. I'm not thinking of other things right now, but I'm sure there's other myths. But there was a lot covered in the presentation.
Yeah, well, and we're going to be back in 2 weeks and to address any questions that you might have. Just please put them in the chat or let us know by email, and we'll try to answer them.
Yeah. And on that, next week, we'll be giving this presentation in Spanish. If you're able to join us for this topic at 7 p.m. next Thursday. And thank you so much again, Dr. Mora, and thank you, Miss Gwen. Thank you, everyone, for joining us.
Can you tell us, please, what's going to be the next topic in English, please, in 2 weeks?
Yeah, and in 2 weeks, we will be presenting on how men should be getting the COVID-19 vaccine as well. So we'll be covering some men's health topics. And then again, that topic will be repeated in Spanish the week after.
Thank you, Ms. Ali. Thank you, everybody.
Thank you.
Thank you. Have a good night.
You too.
Bye.
Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Us in public health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods that cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, is really important.
CERCL is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration,
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
You know, we're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of CERCL is to address the health inequities that our communities of color are facing on a daily basis.